validated methods to gain first-hand feedback from patients and carers. And in the end, the idea here is to identify cross-cutting issues, one of them being indeed access to care. So let's first have an overview of the survey. So the survey was carried out from the 18th of April to the 11th of May. Almost 7,000 respondents answered in Europe. It was 508 in the southeastern European countries. So the people who responded was rare disease patients and family members. So I want to draw your attention on the carers here. Most of the rare disease patients are children, given rare diseases are deadly and they never get to be adults. So often it's mothers who take care of the child, and in that case, they were the ones who answered the survey. The survey was carried out online and it was translated into 23 European languages, so among which Greek, Bulgarian, Russian, Czech, etc. So that gives you an idea of the number of respondents per country, and it was 508 in SEC region. So now let's dive into the results. So before getting to the results, I just want to tell you that I'm going to share with you the European results. And every time there's going to be a noticeable difference with the SEE area, I'm gonna mention that. But if I don't say anything, it means that it was basically the same results in the SEC area. So first, and I think it's the key takeaway of this presentation is the interruption of care. So COVID-19 caused severe disruption to care for people living with rare disease. Between March and May 2020, 83% of rare disease patients' care has been disrupted. So we asked different types of care, and here are, for each type of care, the results. So we asked about medical therapies, and 6 in 10 told us that they couldn't have access to, for instance, infusions, chemotherapies, etc. during that period. I'm going to go clockwise. For surgery or transplant, it was 6 in 10 who saw their intervention cancelled or postponed. For medical appointment, and we're talking here about regular appointments with GP or with specialists, 7 in 10 told us that they got their appointments cancelled or postponed. In terms of psychiatry follow-up, and given what was said just before, we understand that the mental health issue are very high. And so it's 6 in 10 who told us that their sessions were interrupted during that period. For rehabilitation therapies, and this has the highest score, it's 8 in 10 who saw their ergotherapy, speech therapy, etc. postponed or cancelled. And last, the diagnosis tests. It was 6 in 10 who told us that they didn't have access to blood tests, medical imaging, etc., and that indeed prevented people from either getting diagnosed or follow up the disease or follow up the effect of a surgery, for instance, etc. So we can say that the vast majority of those people who need care couldn't have access to it for that period of time. Now we asked a few questions that were more specific to the hospital care for the rare disease patients. And we realized that it was particularly stressful and difficult to access. So first of all, so it was 47% in Europe, but 63% in SEE. They did not go to the hospital because they were scared of catching the COVID-19. So that was very surprising number for us, but not that surprising given that at that time, for instance, protective equipment was very rare. And so people didn't have the protective equipment to get to public facilities without taking the risk of getting infected. And some rare diseases are pulmonary rare diseases. So some patients are considered at high risk if they catch COVID-19. 34% were told not to go to the hospital if their health problem was not COVID-19. So this is another problem here. It's also known as triage, and it's basically when the hospitals are packed, they clearly have to choose which patient they will be treating, which patient they will be accepting, and at that time the COVID-19 people were the priority. So the rare disease people who have very deadly diseases were told not to go, despite the fact that they were sick too, not with COVID-19 but with another disease. And last, for the hospital care, it's 25% reported that the hospital or unit that normally provides care for the rare disease was simply closed. So whether or not they were willing to get to their unit to be treated, they simply couldn't because the facility was closed. So that concludes the interruptions of care. Now I'd like to move on to a more different part that still tackled the access to care. It's like kind of the impact it had on that period. And it actually led to uncertainty and fear for people who needed to access care. So first of all, on patients' health. So we asked a question in the survey on those who told us that they couldn't get access to their treatment anymore, if it had impact on their health. And 6 in 10 found that the interruptions of care were detrimental to their health. And so in Europe, it was 3 in 10, but in SEC, it was 5 in 10. They perceived that these interruptions to care could even definitely or probably be life-threatening. And that, of course, is not a surprise. It means that people, on top of this huge crisis, they were fearing for their life because they had a serious disease and they couldn't be treated. So they were afraid that it would impact badly on their health. In terms of access to treatment, it was 1 in 5 in Europe and 1 in 3 in SEC who were unable to access treatments, simply unable. So when they went to the pharmacy or hospitals, they were told that it wasn't available anymore. What was interesting too, and that I think shows the high level of anxiety that characterizes this period, is that the people who still had access to their treatment reported fear that it would stop being available at pharmacies, hospitals, if the pandemic continued. So we had on one hand the people who simply couldn't have access to their treatments anymore, and on the other hand, the people who still had access, but who were afraid that it would stop any day. And at that time, so the survey was in March, April, and May, we didn't know how long the lockdown measures would last. Now we know that it lasted 2 to 3 months, depending on the country, but at that time it was unknown. Regarding protective equipment, it's 7 in 10 who reported it was difficult or impossible to find, well, gloves, masks, and everything. And that played a big role in the fact that people couldn't have access to care because they couldn't protect themselves before going to public facilities. Now I'd like to end this presentation with a more positive note about the resilience that we noticed, and especially at a local level. So people adapted rapidly, and there's basically 2 pillars here that were very striking for us, is that e-medicine took over from face-to-face when possible. And there was a big role from family, friends, and neighbors, in other words, close relatives, to support during the crisis. So let's start with e-medicine. For e-medicine, we have half of the participants who told us that they have had access to online consultation since the start of the pandemic. And this was new for 25% of patients. So that shows that people, in a matter of weeks, they totally changed their habit to continue having access to care. And so instead of going physically to the GP or the specialist or the nurse, they find a way to call them or email them or having Zoom calls or other forms of telemedicine. Overall, the feedback is good. 98% found prescription via emails very useful. They also found useful online education tool designed to help manage the rare disease themselves, because one of the problem is that people were left alone, and they were used to having people taking care of them, and all of a sudden they were, you know, they couldn't see anyone. So there were online education tools that were shared, and people found it very useful for them to cope with the period. And well, in general, most of them found consultation online useful. I just want to draw your attention on the fact that we asked an open question. An open question is a question where people can write down whatever they want in their own words. It's like a text box. And the thing is, a lot of people were also frustrated because they couldn't have access to e-medicine. So I don't want to, you know, give the impression that it was easy accessing e-medicine. Most of people couldn't, because the hospital was loaded with work, because they had internet issues, because they had a lot of issues. So it's not like it was all perfect. It's just that we saw that it worked when it was possible to take place. And about family, friends, and neighbors now, we realize that they were the core of the help the patients and the carers needed during that period. So it was 64% versus 76% in SEE who needed their family, friends, and neighbors support during the pandemic. And 3/4 of them declared that they still benefited from the help of those people despite the crisis, because for most social care services, they simply stopped during the crisis. And so the only social care that kept going was the family, the friends, the neighbors. And we saw testimonials of, for instance, pharmacists who knew the patient for years, who for the patient to avoid going to the pharmacy and get it themselves, the pharmacist went to the person's home and delivered it in the mailbox. So we saw that at a local level, when people already knew each other, there were a lot of cooperation going on, and people were very much in solidarity with one another. And I'd like to end with the role of patient associations and patient networking, who helped a lot filling gaps. So we had a lot of testimonies saying that patient associations or patient groups sent protective equipment, send information, and most importantly, moral support. I was hearing the Minister of Health earlier saying that we need to call people, we need to reassure people, we need to continue staying in touch. And those patient associations and, you know, basically the networking of people, they enable that very strongly. Well, that concludes my presentation. I thank you very much for your attention, and I hope you enjoyed it. Thank you.
Thank you, Erwin, as well. I hope there's questions regarding this later on. I want to just throw in one interesting comment we had from Alexandra Florescu. I'm not sure of the country which she's from, but I think we can easily assume by the last name. She says that, as I can see in my country, the patients with rare diseases or chronic diseases will have to suffer again, because the increasing number of COVID-infected people and those who need intensive care rose up very high again, and the authorities' measures restrain again their right to treatment. That is why I found very informative and refreshing, particularly in your presentation, the novelty of e-medicine or e-medical consultations, where you actually can communicate with a doctor or medical staff that's going to help you with your treatment. And that might be something useful I'd like to see maybe in other countries as well. We're coming close to the last topic. We talked about social distancing, access to healthcare, and now this is a health and economic crisis, so it's just fair we talk about the second portion of the problem. We have with us Mr. Jason Nardi, General Delegate at RIPES CU, and Ms. Sofia Pereira, a social worker and member of REDPES. So, what is REPES? What is this organization they come from? It's a worldwide network of continental networks that are promoting social solidarity economy in order to transform economy by putting people and the planet at the center of activities. One thing that pretty much stuck with me when I read about their work was the mention of globalization on solidarity. I find it very necessary and even a little bit romantic to think about it, but it's quite something that might help us progress with this struggle a little bit easier. A few interesting and disconcerting pieces of data I want to throw at them before they can start. And one is, of course, going towards the direction of the fact that the vulnerable groups are the ones that are suffering the hardest. By June, and this is according, I think, to the World Bank, by June, the unemployment rate in the region of the Western Balkans rose, and almost 140,000 jobs were lost. In Albania, Kosovo, Montenegro, and Serbia combined, the crisis is estimated to have pushed over 300,000 people into poverty. And this is a very significant number, and I can only imagine how worse it might have been if we did not have the economic parachute measures in place. The persons without stable employment are the ones that are suffering the most, and measures cannot, unfortunately, be distributed equally, particularly at the peak of the crisis, to protect everyone. We had, Erwin mentioned that the access to healthcare, and it's also not just patients with chronic diseases, but people with lower socioeconomic standing have even more difficulties in accessing healthcare and are even more vulnerable in the groups. Before the onset of the crisis, we can say that they were at a disproportionate risk of experiencing negative health and socioeconomic impacts in general, and this has just made this situation worsened. And even so, the socially disadvantaged individuals can develop serious health issues and at a younger age compared to the rest of society, some studies find. And even worse, at this time, they are less likely to seek treatment because of the fear of the costs it might imply. So many people would opt not to get tested or to ask for medical assistance due to the very likely high out-of-pocket costs that might arise that they will not be able to cover. So my question to you is, how in the middle of these turbulent times can we bridge the social divide that is taking toll from the economic crisis? And secondly, how do we protect the economy, but at the same time the most vulnerable ones suffering the consequences? And how do we manage the balance between the two? Please go ahead, the floor is yours.
Thank you very much. I'm really honored to be part of this session. And I have to say, I was quite stimulated by the previous interventions. I think that between the security versus freedom opposition, we have the chance today to put a different framing, which is solidarity and democracy. Putting those at the center of our action. I'll try to share a presentation, although I'll skip a bit and try to answer also your questions, because I think that today the major issue for young people, and not only for young people, of course, but is the whole uncertainty of the future. So where are we going today, and what expects us in the near and longer future? So we have different possibilities of developing our economies. I think that the globalized financial economic system that we have today has had a crucial role in the spreading of the virus. It's not by chance that the virus spreads so quickly with international travel and trade, and has also widened the economic gap in the population that already existed before, and created greater inequalities. So this is the first point I would like to set out. And the health policies and the organization of the health systems that we have today have changed in the last decades, going towards a more privatized and market-driven model. This has also influenced a lot of the capacity of reaction that our countries or states have. I can see it from my country in Italy. Just maybe 20, 15 years ago, we had a lot of local and community health centers, and now they have been concentrated in big hospital structures, and those health centers have been defunded or even canceled. So people are now having more difficulty in accessing the public health system and have to go towards the private system, which is available for those who have the possibility and the resources. So the problem is that we have an economy that is not geared towards the community needs and the public interest. And in situations as this emergency of the pandemic is showing, it becomes more and more evident. So the world is burning not only for the virus. We have a series of crises that are one on top of the other. We have an economic crisis and financial crisis that is, they tell us is sort of systemic part of the system and that it goes in waves, but we see that it's progressively worse. We have a huge ecologic and climate crisis, and we have today also this generalized health crisis. We are, and we've seen it in the last year and the year before, for instance, the demonstrations in Chile, but in many other countries, the need of re-democratizing our economies, and that we are a bit the children of the financial crisis of 2008, and today we really need to go beyond what that brought us. The youth are very aware, I think, today, much more than in the past, of these situations. And it's not a chance that the climate justice movement has such strong youth participation. So solidarity and democracy are really, I think, at the center of the solutions that we should look at. And how we reorganize our political, social, and economic life is if we try to go beyond the system we are in today, and we look at how we can think of sharing and using the paradigm of the commons instead of the paradigm of competition and of individualism and consumerism. So to go from an egonomy centered on the individual and on the private to an economy, which is the actual meaning of the word, because eco in the Greek origin is about caring for the house, the community. And the economy is how you deal with that. We also have an economy which is very modeled around a patriarchal system. And this makes visible only the productive part of the economy and not all the part of the economy that is not calculated in the gross national product. All the informal sector, the subsistence was the care work, the housework, and so on, and also, of course, nature not as a commodity. So if we think of a social and solidarity economy, we're looking at an economy that actually satisfies our human needs. through economic activities, through exchanges, through production, consumption, distribution, but in a way that is not separated from social justice, from the need of mutuality and cooperation that is at the core of our societies. We can have many alternatives. Actually, these already exist for many years. I won't go through all of them, but I think it's important to know that we're not just thinking of an utopic world here. Well, we're looking at a lot of initiatives that not only exist, but are networking together and are creating alternative sort of markets. And this phenomenon is growing more and more all over the world. So if we want a future capable world, we need to really rethink how we produce, how we distribute, how we organize our enterprises, the fact that the ownership and those who work in the enterprise can be the same people, like in cooperatives. We have to think ecosystemically, so integrated in not only the nature, but also the social environment in which we're in. And profit does not have to be the sole way of sort of stimulating the economic system. Finally, if we look at with a more systemic approach, and I'd like to stimulate you on this and then pass the word to Sophia. I think I already took too much time. I'm sorry. We have to think of doing the opposite of what has been done in these last years. Not privatize, but decommodify and deprivatize. This doesn't mean that everything has to be public in the traditional sense that we know, but it can be part of the commons, which is something that is managed by the citizens directly with the public structures. We have to redesign our cities so that they are within the ecosystemic limits, and we have to regenerate the countrysides and our food production systems, because our immunitary system also depends on what we eat and how we live in the environment. If we have a very highly polluted city and we eat very elaborated and sophisticated food that weakens our immunitary system, then we're more subject to pandemics as the one that we're living today. So thanks a lot. I'm going to leave this presentation, which has many more things in it, to the organization, and I'll pass the word directly to Sophia.
Thank you, Jason. And thank you to the organizing team for the invitation and this amazing initiative. And also thank you to the previous panelists because you brought interesting ideas about mental health that I think it's an important issue that we can't forget during this whole process leading with COVID-19. The idea of long-term exposure to uncertainty, I think that we need to focus on the long-term impacts of this pandemic crisis and reflect on them. And also, thank you, Aaron, because you brought the issue on care, community, and how we can cooperate. And I think this is a very important topics that we need to be aware of and integrating future practices. And I will also give you some clues on that. I will share my screen. I prepared just a brief presentation to be easier for you. And I also want to say hello to everyone who joined us today. I hope you are all healthy and safe. So I am myself a youth worker in the social field. I work in APDES, that is a Portuguese NGO for development, and I represent the National Network of Solidarity Economy at RIPES Europe. My role here today is to just present you some alternatives and transformative economies that, as Jason said, they are in place already, but they are really important alternatives to overcome this crisis, but mostly, and I think this is very important, to prevent future pandemic or other kind crisis. Because as Jason said, our world is burning and we have a lot of social, environmental, economic issues that are impacting our lives, especially the youth. So this is important to be aware. And I will just, open some perspectives and give you some new concepts, and hopefully we can integrate this in future discussions. So my proposal for today is to focus on cooperative learning and peer youth cooperation, and then its connection with social solidarity economy. And to give you like some examples or case studies, I will present to you 2 European projects that are focused on social solidarity economy in Europe and related to the VET field. So starting with cooperative learning. Cooperation is basically working together to accomplish shared goals, and this can be promoted in learning process. And this learning process is open concept, let's say this way, because we are talking in classrooms, training, our specific jobs, or any social situation when we want to learn or we want to teach. In this sense, the ideal learning process, the students, trainees, or any other person would learn how to work cooperatively with others, have fun and enjoyment, something that we should not put away, and work autonomously on their own. That is, cooperate gives you the possibility of group and individual development in the sense of autonomy. Moreover, we can transfer the idea of cooperation to any life dimension and group purpose. Youth peer cooperation involves work cooperatively with others who are more able or experienced in some area and give them the tools to reach out specific contexts. Once again, the idea of having peers can be transferred to any social dimension. The peers are considered more acceptable sources of information to young people, in this case, than professionals and adults, and the approach takes advantage of pre-existing channels of information sharing. The idea of youth donating or working to their community or peer group for different motives is appealing, and much of this appealing comes from the expanding use of community participation and mobilization approaches. And this is important for me, at least, because several community-based movements have this peer methodology in their essence. This approach has many benefits, individual and collective benefits, and I would like to put your attention on the social scenarios, because as we can develop the aware of young people to these social scenarios, this could be the basis for a stronger and more developed critical thinking and impetus for social involvement, looking forward to creating a better world where competition and profit are not more efficient in the development of the economy than cooperation and mutual benefit, where the economy is based not on exclusive financial growth, but on research sharing, and where solidarity is not so just a philanthropic activity. And all these concerns with social solidarity economy that Jason spoke a little bit before. And social solidarity economy, I will say SSE, is an alternative socio-economical model that is present in several parts of the world, and it is rooted in inclusive values and practices highly needed in the era of transition. So SSE seeks to reorient and harness the state, policies, trade, production, distribution, consumption, investment, money, and finances, and ownership structures toward ownership structures towards serving the welfare of people and the environment. What distinguished SSC from many other social change and revolutionary movements of the past is that it is pluralistic in its approach. SSE appears to be a way to the criticism of the current model of predatory economy and unsustainable patterns of production and consumption that in some part led us to the crisis that we are living today. SSE notably pursues economic activities that prioritize social and environmental objectives rather than profit. This different approach thus offers considerable scope to recalibrate economies toward more sustainable and inclusive patterns and increase the chance of meeting various sustainable development goals ranging from poverty eradication, the promotion of decent work, food security, gender equality, healthcare for all, that is very important, and sustainable production and consumption, among others. Now I will present two Erasmus Plus projects in which we work with different approaches towards learning, VET, and SSE. The both projects were funded by the Erasmus Plus program of the European Union. They were coordinated by APDESH and had a European scope, and HIPES Europe is one of the project partners. The first one was implemented from September 2016 to August 2018. And the main goal is to affirm SSE through initial vocational and educational training curricula innovation. So we are here specifically focused on youth and future generations. So the idea is to have a comprehensive training and professional development of younger generation, integrating social economic models, alternative social economic models in their framework of ideas and attitudes. And for that, we developed 3 training models for IVET that are well structured with different indications, pedagogical indications, inspirational research, tips for trainees, and especially case studies from different European countries, presenting real life examples. This is very important to learn from the others. So we have models on values and principles. We had a model on democratic management, and the third one about ethical and solidarity finances and resources. And all models were tested by IVET trainees, and then were developed some advocacy strategies to include them in national IVET curriculum. And if in this first example, I focused on the content, now I would like to present you a project more focused on the methodology, that is how to do it. How can we implement this kind of training that will impact future generation in their daily practice, namely economic practices? The main goal is the same, is to promote SSE in Europe, but now we are focusing the training of trainers. In the first project, we created the models, as I present to you, and the partners concluded that it's very important to have trainers who are familiar with SSE values and principles. We need the stakeholder to spread the word on SSE. In this sense, the project aims to contribute to innovation and in vocational training programs, aiming at the civic and professional development of people by integrating alternative social economic models into their attitudes and ideas. I just want to say that we are using action research methodology. So we start with the context analysis, which was fed by the first project's conclusions and inputs from the mapping of VET trainers' competencies and existing SSE training programs. And we saw that the training practices are not always consistent with the SSE principles. So now we want to create an innovative training in action course designed in a participatory way. And we already tested it in the national context, and the 8th training day training allowed put in practice a training in action program co-designed with the participants over the last year. So we focus on innovative and participatory methodologies, that is to give the voice to the people in the ground, creation on pedagogical materials, and implementation of different action research process. The training action course aims to promote a process of learning through experience, practice, and involving the target in SSC local initiatives to have a better frame within the SSC local context. We held 80 training days, reaching 61 participants in 10 European cities. And now we will promote the trainees exchange, that is mutualized experience, methodology, and suggestions for a validated training in action proposal. Lastly, because I think that I'm having without time, I just want to point out the concept of training community that is central in this training. And it will have a double focus. On the other hand, to create a training community among the trainers who decide to participate in this process and trainees. And we give them the voice in this training because they are involved from the beginning in the design of the training, that is the co-design, starting from the sharing of the training objectives and continuously involving in the following phases in the peer-to-peer learning environment. And also, on the other hand, involve local actors that gradually meet the action research in the process of training and transformation toward a sustainable and solidarity local development. In this way, we can truly transform step by step our communities into training communities for full citizenship for all. I think this is central, where each one takes responsibility for the common good and shares with others their skills in a peer-to-peer perspective. And also, I want to highlight the concept of care, a core notion in SSE, emphasizing the reciprocal responsibility to provide each attention to fair participation, well-being, and safety feelings. And this is the ingredient at the center of the emerging learning community. I just want to finish saying that these local training communities are still existing, and in some cases, they are trying to cooperate economically, namely replicating other experiences. For instance, in Portugal, we are trying to create a group of consumers in Porto. Giving you some context, during the Portuguese Training in Action course, the training community decided to continue work together and try to strengthen SSC in Porto. And also we have monthly meetings. We are still trying to figure out what we want to do and how we want to proceed. But one of the activities that we are developing is a local and self-organized group of consumers which contacts and buys directly from the producers. So as you saw, I start from learning practices. That is the first step to reach out the next generations, but I'm finished talking about economic cooperation experience. So this is the cycle for us. And of course, I remain at your disposal to clarify any possible doubts. And thank you for listening to me.
Thank you both, Sophia and Jason. I will move on with a little bit of the comments we had in the chat, and then I'll invite you to participate in a poll by our organizers. Just to reiterate what Sophia was talking about, she mentioned you have Joanna, who's a participant of the project you were presenting, and says it was a really unique and exciting experience. Recommends to everyone, if they're interested in training, to check it out and to feel free to reach out. We had two more debates evolving in the chat. Daria and Joanna talked about privatization of healthcare in Poland and Portugal and the inefficiency of public healthcare, pushing people towards using private healthcare as an only way to access healthcare as a whole. And then Nicola launched the whole debate here, starting with, well, I'll tell you what he wrote about and you'll imagine where the debate went. Neoliberalism economy imposed in a large scale of meaning to cut health investment. Our generation was seduced by the idea of a free market, which we could be realized completely with. We didn't think that education, health, art, science, and culture were important as well. Why? Because neoliberalism gave us a justified egoism. And there's a lot of opinions here from Jovica, Angelina, Igor, and I invite everyone to look at the debate. But now, I will invite our hosts to launch a poll on our Zoom on the Zoom channel. Just pay attention to your computers or phones if you're using it on those devices, and a poll should pop up any minute now that you will be invited to fill in. I think you can see it on your screens. I'll invite everyone to click on the options in the poll, and I'll ask our staff here to just let me know once we're done with that, so we can continue with the next portion, and that is the Q&A. Jason, Sophia, Erwan, you have access to the Zoom call. Has the poll happened yet? No? Okay, we're waiting. We're all patiently waiting, but as you're doing so, I invite you to look at this whole debate on neoliberalism and privatization and economy that's going on in the chat. So I think, yeah, we have a note from the organizers, and I think we're okay to move on with the Q&A portion. If we're not, I'm sure someone will interrupt me and let me know I'm doing something wrong. I want to go to the very first question we heard, but before that, a guide to all of our participants. If you want to ask a question, please feel to write it in the chat. Please feel free to raise the digital hand in the Zoom call so I can notice you, and please don't wave your hand at the camera because I won't be able to see you. So we have Igor with a question, and before we get to Igor, I'll read the first question from Anna, who was patiently waiting, and I think I'll direct it to Nenad, even though she did not specify. I think it goes in that direction. So 1 second so I can scroll back. Anna, I can see that in times of lockdown or movement restrictions, people follow, but still do not trust the effectiveness of these measures. Instead, they are in demand of a stronger health system or greater flexibility. Even if people are responsible and are socially aware, could trust the decision makers be restored? Nenad, it's not an easy question, but...
That's $1 million question, I would say. As for the first part, well, we did have a lockdown which was pretty severe here in North Macedonia, and if all of you remember, this was, I guess, late May, early June, after the Muslim holiday of Ramazan Bayram, the numbers starting to rise rapidly. And all the new cases of this second wave, 1.5 wave, whatever you want to call it, were in fact originating from the times that severe lockdowns were in place. It opens up a whole new debate on several issues. First, can the state be a panopticon, as Zygmunt Bauman would say, and can the state see everything and oversee everything and be so coercive and controlling that all these rules that were practically legislated be implemented 100%? The obvious answer to this question, if we take in consideration the history of what was happening globally in the last 6 months, is no. There is no state that can overlook to that level implementation of measures, and whether, colloquially speaking, people were jumping over fences to celebrate religious holidays, for instance. There is no state that can take that burden, and the state is absolutely not an all-seeing and omnipotent force. The state cannot function like that. There is no state that is strong enough, no matter how coercive, no matter whether it's liberal, whether it's autocratic, that can be so coercive to be successful in this way. Yet people have too little rely on themselves and their consciousness, I think, and too much rely on the fact that the state should do something. The state has a limited potential, period. And that's something that we have to deal with. I can understand the urge of people saying, okay, so the states should do something and resolve this issue. But they have to have in mind that this is a limited set of options that the states have in order to balance out security and liberty, in order to balance out economic disaster and loss of lives. And it's a very fun slider in between that you have to pull left or right in order to maintain a specific balance in society. Can trust in institutions be restored? When trust in institutions in this region specifically was never too high. So it's nothing new that we don't have trust in institutions. This probably just additionally ruined it in a way, or contributed to a worse picture of that. Where there is one good thing. There is the bottom has been hit, so there is only one way up. So basically, this is kind of good news amongst the sea of bad news. I think, yes, it can be restored once the situation is controlled, and once we have a sober and a distanced approach to what really happened in the last year or so.
Thank you, Nenad, for figuring out a way to make the worst sound like it could get better. But no, that is the reality of things, and this is an evolving situation. If you look back at March, we were living completely different lives than what we are living now in October, November. But the cases are much higher. So there was initial overreactions towards the safety that balanced out. I hope we don't spend too much time figuring out where the balance exactly lies. But of course, we have to prepare that at least half a year to a year might be spent in these conditions as well.
Can I just
Please
drop in? It's all a matter of reference point. Probably February or March through May, we were hoping for completely eradicating COVID-19. And that was a reference point. We will succeed on completely eradicating the disease. Now, the reference point is we don't want the Bergamo scenario. So we completely changed perspective. We completely changed our dioptry. Because the contagion cannot be controlled to the level we thought it could be. So basically, that's why the difference is in behavior of people, in measures, and we saw that the economic price is as bad as the price in lives, because the economic price might also result in prices in lost lives on the long run. So basically, it's the short fix versus the long run perspective, which is very sensitive in terms of the essence of the political debate globally and within nation states.
Exactly, Nina. Thank you. There was a comment, I'll get to it later, but in the meantime, I just want to ask everyone that if you want to ask a question yourself, feel free to go to the participants tab, find the raise hand option, and I'll notice it and give you the floor. But if you don't feel too comfortable speaking, you can also write the question, as several people have done already. I will now invite Igor Stoilovic. It says Crta next to his profile. I'm not sure if that's Crta, the organization. It would be interesting if that's the case, to take the floor and ask a question, and make sure you tell us who you're asking your question towards.
Yes, it is Crta organization. And well, I'm used to participating in these conferences, like with this, which organization and the name. That's why I stated out. So first of all, thank you for this opportunity to be part of this amazing conference. And secondly, I would like maybe to refer a few comments, hoping that it will provoke some of the speakers as they provoked me to make these kind of comments. So I would like maybe to continue on this level of trust in the institution as a must-happen thing to maybe go through this situation. And the first question that was mentioned before was, can we restore the level of trust in the institution? My question is regarding, or the comment maybe before is, when have we had trust in the institution even before the pandemic? I think the pandemic just highlighted the level of lack of trust in the institutions. And I think it can be seen through different examples. One is elections, of course, something that I'm most familiar with, and the fact that elections have not been seen as something that is very questionable in regards to the pandemic. And the fact that elections were actually held in most of the Western Balkan countries in the last few months during the pandemic. The second matter is the issue about travelings, the fact that most of the countries that are not members of the EU are now facing the lack of mobility, which goes against the basic principles of European Union, but also basic questions of the human right. And one more thing regarding this lack of trust between institutions is the fact that government actually invited young people to participate in different actions regarding pandemic. On the other note, all the polls and all the researches regarding different situations when young people were asked, do they feel comfortable and do they feel that they have the skills and the knowledge to participate in this kind of crisis, they said no. So actually, I think we are in a like a bubble, in a circle where we don't have trust in ourselves. The government does not trust its citizens. So the citizens are to blame for the pandemic. And on the other hand, the citizens do not trust the government, yet they go out and elect the new one. So my maybe the last comment would be that the situation about the pandemic maybe showcased the worst case scenario, as it was already mentioned. I think we hit the rock bottom. And I think that the pandemic actually will slow down each and every process that we have on a political, but also social and every other level.
Thank you. It was interesting to hear your perspective. I also saw that Jovica Dimitrovsky is interested in maybe joining the discussion. If you would like to take part, please just mute your mic and turn on your camera. And in the meantime, I'll read another question. We'll take a few sets and then I'll give the space to speakers to respond to the questions and give their opinions. I'm also trying to be cautious of the time. We have around 20 minutes for this, including a wrap-up. So as brevity is appreciated, as short as you can ask the question, the better, so we can have more opinions. I'm not seeing Jovica, but in the meantime, there was a question from Dora. The question is about the possible long-term consequences, the view regarding physical distancing as a response on pandemic, and how it influences not only distrust in the systems of countries, but also distrust between citizens and the society as a whole. We can see that physical, and many people see as social distancing, consequently leads to strengthening individualism, with reducing the feeling of collectivism and influencing higher number of people with anxiety. As requested, we have an address. This is for Professor Markovic. Do you believe that the rise of cases of anxiety could be a long-term consequence? That the rise of individualism and social distancing will stay or influence the society even after the crisis? And can or did the pandemic change the society permanently? I will see if we have anything more. These are comments as much as I can see, so I will not be reading all of them out loud. I'm sure everyone can do that on your computers, and I invite you to do that. One more check for raised hands, and then I'll throw in a few questions for our speakers as well, and you can reference to what Igor said, the comment I just read. I will throw in another one on the economy. How do we combat unemployment in these conditions? I think this is for Sophia and Jason, particularly youth unemployment. We see interesting numbers. We don't see it exactly rising, but we are safe to assume that in many countries, youth constitute this kind of gray economy where they don't have proper contracts, they just have internships, they're paid directly with cash, and they're losing jobs or being disenfranchised in this regard. But at the same time, when we need people to work in lockdown situations as delivery personnel or as hospitality staff, this is young people again at the forefront. How would you respond to this really quickly? And one, I'll open for anyone in the panel if they want to mention. It was brought up shortly in Jason's presentation. The patriarchal impact and the disenfranchisement of women in particular during the crisis. Now, because of the lockdowns, kindergartens, schools would close, and the labor of taking care of the family and offspring falls down to women most often, as well as the care of elderly people or potential COVID patients. We also saw a dramatic rise in the number of domestic violence, and victims, who are most often women or young girls, even fear to to report these incidents more, because it might result with also a fear of contracting COVID if they're admitted in a hospital or if they go to the police station, and also if they go to a shelter center. So how do we also protect vulnerable groups in this regard as well? So these are a few questions for everyone, I think. There's one or two. You can all give short responses, a minute or so, and I'll be following the chat and the participants list for your raised hands if anyone else wants to join in. We can start with, I think, Jason or Sophia, and Erwin, if there's a comment on your part, you can follow after, and Nenad will be last in this particular case. Please. Sophia, Jason, if you're feeling up to it, you can kick us off.
Okay, I think I can start because I'm not seeing Jason right now, so I don't know if he's here. So I will start about this issue about women, actually because I'm criminologist, so social solidarity economy is other thing in my life, so I can maybe speak a little bit about this. The thing is, mostly of the family crimes, let's say this way, happen with people that are close to us, that are our family, our close friends, and we just give them space to talk, to say things to us that we won't allow anyone else to say. So this pandemic issue also increased this possibility for these kind of situations in our family. It's not only the fear of telling to the police or other authorities, or just the fear to contract COVID-19 when we are telling this, but it's also the opportunity to have this and offender to feel that he or she can do this and no one will say anything. Because if you have fear before the pandemic, now you have even more. So the thing that was said before about share, communicate, use personal contact, allowed for victims or ex-victims to be in touch in online ways could be a way to overcome this. Of course, the offender can manage all this, but I think that this idea of using new tools is very important, not only in health and security, but also in employment. How can we use new technology tools and new approaches to reach out to these people? And how can we use the online tools to be with them? This is not only for human, but also for all kinds of people in vulnerable situation. Because in Portugal, I work with some of these people. Unemployment was but also drug users, sex workers, and so on. And what we are trying to do is to increase these online tools. That is WhatsApp, chat, Zoom, contact calls during the day many times. So we can reach out these people for many, many possibilities. Of course, this is very difficult, and I think that we should care how can we will deal with this situation in these people after the lockdown. When we have a vaccine or something like that, and we go to the streets, we cannot forget that during this whole month, a lot of people have some traumas, and we need to rethink our health systems and other stakeholders in the field. How can we deal with these people? How can we will have intervention that could be that when we have in mind that all the things that these people have during the lockdown. And about the youth, I just want to say that for many, many decades, the young people was not instructed how to participate. In schools, we don't teach young people the importance of voting, the other ways that we have for social participation. And of course, the policy and decision makers also don't allow for many possibilities of social participation, social and civic active participation that exist in the world and we don't have in many countries, for instance, in Europe. So it's not only to say that now we are facing this COVID-19 pandemic and all the difficulties, is to say that from the beginning, we have an educational system or other kind of systems in our society that don't allow that and don't give the necessary tools for young people to raise their voice and to have social movements and have a voice in this society. And vote is very important. It's very, very important. It was an important fight, but it's not enough today for young people. And I speak for myself, vote every 4 years is not enough. We need more participation, but also we need to say to young people that it's possible to give this participation. Otherwise, we will give them the tools and they will say, yeah, we are not prepared. So it's a big job and a big task that we need to do in our society.
Thank you. Daria agrees to some portion or builds up on what you were saying, that the worsening of the mental health also increases the consumption of harmful substances such as drugs and alcohol. And that furthermore multiplies the violence towards the most vulnerable. I want to go out to our online panelists if you want to respond to any of the questions as well, being mindful of everyone's time. I see Jason is making attempts, right? Please go ahead.
Yes, thanks. I'd like to respond to the issue of trust. I think there is really a big problem here because as the person who intervened before around that, it's not just that the citizens don't trust the institutions and the government, but also the policies of the government and the ways that this particular case, this situation, but in many other cases as well, is reacting is of mistrust of the citizens and taking out the responsibility from the citizens and imposing a set of rules and even a curfew or lockdowns because they don't trust the citizens. Now, it's true that some citizens might not be acting in a social way, but the majority usually is responsible. And by giving them the trust and not fear, which is the other tool that is being used, fear and punishment, I think the improvement would be much, much faster and build on the sense of community and of solidarity. I think there's also a big role of social media that has spread mistrust, confusion, conspiracy theories, closed bubbles of opinions that reinforce each other, and the fact that also, well, young people grow with these tools and with social media without being really taught how they work, what's behind them, and how they help reinforce certain stereotypes or beliefs, and close people in sort of circles where they're not confronted with other opinions, or if they are, it's done in a very violent way. Well, I think that also should be taken into consideration. We should, in school, for instance, we should learn how to use social media, how to use the digital tools that fortunately we have today, but they can also be part of the problem and not just of the solution. So I think that we can build the alternatives that we need today. We have this incredible opportunity to do it because people are more aware of the problems and are more aware of the fragility of our public institutions. So they could take more actions and agency. And I could just say one case and then I'll finish here. When in Greece there was the big crisis following the austerity measures and the crisis of the financial crisis of the state, one of the reactions was to create solidarity clinics, pharmacies, and hospitals managed no longer by the public system, or not only by the public system, but by professionals and volunteers working mutually together in the community. And that was an amazing success, I think, cooperate instead of competing in the economy and in society.
Thank you, Jason. I'll give the floor to Erwan if he has any last. Okay, I see he's ready. Any last thoughts to share with us before I bring it back to the offline IRL panel?
Sure, I just wanted to bounce back on the role of women in the care of, so for me, it's for the rare diseases, but it's for anyone in the family who's sick or who's old or who's not capable of taking care of him or herself. In the rare disease community, at least, it's for the immense majority of the cases, the mother who takes care of the child or the spouse. And I also want to draw your attention on the fact that it has created a lot of problems for their career, because what was the new rule was working from home, but special schools closed, so the women had to work and take care of their child, and that was simply not possible for most of them since there was no more care for them. So I just wanted to highlight that it's true that it's very unfair. Those periods are very unfair for women. And previously, there was a comment on the fact that we couldn't travel across countries in Europe anymore. I just wanted to highlight the fact that in terms of health, that has been a catastrophic for the people who needed, for instance, surgery or transplant abroad, and especially in small countries like Macedonia. I have contacts there, and so it's not uncommon for people to get treated with special surgeons who are specialized in their disease outside of Macedonia, and they couldn't do that anymore. So that, and same for transplants, some organs were stopped at the border just before getting to the patient who needed it. So we saw, especially in cystic fibrosis and other diseases, some organ transplants that got messed up and eventually didn't happen because of that. Yeah, that was.
Thank you. So we're going back to Nenad, who had a very easy question on, I'm joking, but the long-term implications on mental health. And I'll throw in another question for you, because we're at the very end, so one personal from me, and we didn't bring it up. Education. Even though it's not young people that suffer the health crisis the most in terms of health implications, schools were the first to close down to prevent the spread, and we moved everything online. We have the UN saying that this could be the largest loss of human capital, meaning looking at health and education in years. Will there be any chance of us restoring what was lost, and how do we take that path as well?
I think there is a huge chance once the COVID-19 crisis stabilizes itself, or is stabilized by someone, probably by a vaccine, I guess, that we will be very fast on, back on track. In my personal experience, online teaching is doable, online education is doable, but it simply takes out the joy of being a professor. And that's the worst problem. It's not what I applied for, basically, when I wanted to become a professor in my life. So I have more of an emotional than a functional problem with online teaching, because I'm a very face-to-face person and I enjoy direct contact. And in all honesty, it can never, ever be replaced in the classroom. This is just this withdrawal in the digital world, I hope, is just temporary, though it's a good tool maybe for more advanced students on MA and PhD level. For BA students, I think that personal contact is very important. Online events do not stimulate debate too much. That's a huge problem, and I teach political science where debate is crucial. On the question of individualism and collectivism, well, I wouldn't say that individualism or collectivism are bad words or good words per se, because there are two types of individualism and two types of collectivism. And I think that Sophia and Jason touched upon this issue, especially on this collective part. And I'll try to make a diversification. When we speak about individualism, I would refer to Charles Taylor, where he speaks about atomistic and collectivistic individualism. There's nothing wrong with collectivistic individualism. I'm myself, I have my own perks, my own habits, I have my ego, but I'm part of the whole. And I don't socially exclude myself, and I participate. So there's nothing wrong with collective individualism. Atomistic individualism, then again, that's followed by social exclusion and selfishness, can be quite a problem. And then collectivism on the other side can mean what Jason and Sophia discussed, mutuality, solidarity, helping other people, but can also mean, in terms of Elnel Gellner and his famous works on the enemies of freedom, can also mean reintroducing or forcing members of a religious, ethnic, or some other community certain habits and certain ways of life that can be oppressive towards the individual, just under the pretext of some kind of collective belonging. And this is, in fact, if all of you remember, this is what, in fact, this second type of collectivism is what brought the second wave of COVID in our country. Because people, some of them even, especially younger persons, forced to participate in certain kind of family gatherings that had a religious pretext, practically started to uncontrollably spread the disease, mixed with all the factors that we already discussed. So there is good and bad individualism and good and bad collectivism. We really have to choose. And I don't think that the Balkans has a problem of too much individualism, honestly. I think it has a problem of the wrong type of individualism, and also of the wrong type of collectivism. So basically, in the interplay of these factors, we must find the answer, because categories are very, very easily confused when we discuss in this context.
Thank you, Nenad. I would like to extend thanks to everyone who participated in the online discussion: Jovica, Dora, Nicolo, Daria, Angeliki, Igor, and Eva. And I'm sorry if I'm missing anyone, but it was a fun thing to follow how your thoughts developed based on what we were hearing from the speakers. I'll try and wrap it up, but also you have a very proactive message from Anelias, and you can follow up on this. Once the session ends, you are welcome, if you want to, stay 10 more minutes to remain connected and to discuss and reflect on the session. And a little bit of a reflection on my part, finally. This crisis has restored us to re-evaluate, reassess, and see how we understand the basic concepts and values on which our societies are developed. We are still struggling to find the lowest common denominator that causes an individual to feel as a part of a collective, or what is the appropriate level of new measures or limitations that could be imposed, but to still be understood and complied to by citizens, and kind of find a way to function as a group. The crisis has also caused new lines of division between groups. We have lines of divisions between everyone who's on the front lines and the healthcare personnel, and I would say even everyone else who is potentially not compliant with the measures, because it creates these two worlds we cannot function in simultaneously. We have, particularly with the generational gap that's created, elderly who are among the riskier groups in terms of the implication from the crisis, and young people whose lives were interrupted, but these groups still have to remain under same roofs in large families, and causes a tension or a fear of what anyone could do to the other. We have a disparity in terms of economy. We're looking at state budgets being stretched thin and debts rising. At the same time, there's efforts to protect the most vulnerable individuals, but also to keep businesses and economy afloat, which is a very delicate balance to try and have. And this is where social structures come into place. We're not isolated islands in the system. Everyone has roles they can play to contribute, even though we might feel quite helpless and even tempted to deny the crisis that we're living through. We have parliaments who are here to do oversight role over governments. We have academia and science communities who are here to bring new facts to life, and who have greatly contributed in also our understanding of the health, but also the social implications of the crisis. We have media who are there to share key information about the truth we need to know and how to follow it. as well as civil society, who is trying to find active roles to contribute and assist societies and the ones most vulnerable in overcoming this. And these are all panels of your conference, and you will be able to dive deep in all of these topics and consider them. We restored and reignited a debate as old as democracy, the debate on security versus freedom, but through a new lens. And currently, we're looking at society and every single aspect of it through a new prism that we were not aware of before. And maybe it will give us a chance of learning and growing stronger out of this. We have to make the vulnerable groups seen, in society. Decision makers have to make snap decisions and have to make fast adjustments to the context. Sometimes groups are lost in the sieve not because they're not relevant, because they were not noticed. And this is where all of our role pops in, to point out what can happen on mental health, on women in society, on persons with disabilities, on individuals with rare diseases, and how to make sure decision makers consider them. There was a case of this about this in North Macedonia, where young people were not accounted for in any of the initial measures, but youth civil society sat down, wrote an analysis on how this impacts youth, and delivered recommendations to institutions, and several of those actually made it as a reality. So we have to find ways to be vocal and to remind on the missed parts. We have to look and learn on how our paradigm of society is changing and how we can build from that towards the better. And we have to build support networks for each other. And this goes on every way, on individual way, in our educational systems, in our jobs, and everything we can do. And finally, understand the meaning of solidarity and try to practice it in our everyday lives. No matter how long this lasts, solidarity, trust, and science seem to be the key aspects to, I would say, survive this battle. I cannot say win, because the casualties have already been too many, more than should have ever happened. So it's a matter of just surviving and building from it rather than winning. Global cooperation appears to be more important than ever, and we are at the largest loss of human capital in the century. We have to accept, we have to plan, we have to adjust, and see what good we can make come from this. Thank you all for the attention. I want to welcome and thank all of the speakers we had, everyone for their discussions, and I think I'm signing off or logging off, however this looks like. And if there's interest, I'm giving the floor to Anelia for you guys to continue your reflection on the session. Have a productive rest of the day, and thank you for your interest and patience.